Apex always means the pointed part of an organ. So this area right in here will be the apex of the lung. The base will be the broad portion of the organ, and the base is going to rest on the diaphragm. This muscle here is the diaphragm. The diaphragm is the main muscle involved in ventilation or breathing. As it moves downward and back up, it is going to also move the lungs with it. So we'll talk about ventilation in lecture. Each lung is divided into lobes by fissures. And you can see a fissure here that is a horizontal fissure. So let's identify, this is my right lung. There are 3 lobes, an upper lobe, a middle lobe, and there's a fissure right here, and a lower lobe. Let's look at the fissures. This fissure here is a horizontal fissure. It goes straight across. This fissure here, notice how it goes at an angle. This is the oblique fissure. If I ask you what fissure separates the upper from the middle lobe on the right side, you're going to tell me the horizontal fissure. The middle is separated from the lower lobe by the oblique fissure. You also need to know that the right lung has 3 lobes. How many lobar bronchi will the right lung have? 3, 1 for each lobe. The left lung is going to have only 2 lobes, an upper and a lower, separated by an oblique fissure. Notice how it's going down at an angle. In addition, the left lung is going to have, see this notch here that accommodates the heart? That is called the cardiac notch. Because the heart there has to be a little area here for the heart, the right lung is going to be slightly larger than the left lung. In this view, we can see an internal view of the lung. Here you can see the carina, the trachea. You can see it there as well. Hopefully by now you know that this is the ascending aorta. You should be able to name these for me. Remember the brachiocephalic trunk to the common carotid on the right side and the right subclavian. The middle, remember, is the left common carotid, and this one is going to be the left subclavian. This is the superior vena cava, inferior vena cava. Let's go back to the lungs. Oh, this is the esophagus, right in here, and it pierces the diaphragm going to the stomach, which is going to be sitting here. This area right in here that's outlined in white, this is going to be the hilum. Notice this is where the tubes enter the lungs, whether they are arteries or veins. You can see the 3 lobes with the fissures. In this view, you can actually see the cardiac notch right here. This represents the diaphragm. Here are your 3 lobes, upper, middle, and lower of the right lung, upper and lower of the left lung, horizontal fissure, oblique fissure, oblique fissure. The diaphragm, and this is actually your liver. The nerves that innervate the lungs are going to enter through the hilum and follow blood vessels and the tubes. They make up the pulmonary plexus. You're going to have parasympathetic and sympathetic fibers. Finally, let's look at the coverings of the lungs, or the serosa. This is review from AP1. Remember, the serous membrane has 2 layers, a visceral layer that clings to the surface of the organ. So the visceral pleura is this kind of burgundy line here that's clinging to the surface of the lung. So this is your lung. The parietal pleura is going to be this darker blue line here that's up against the cavity wall. And in between, you're going to have this light blue area that's called the pleural cavity, and it is filled with pleural fluid. That fluid is a lubricant that prevents these two pleura from rubbing up against each other when you are breathing.